All right, Jonah. Patient assessment medical. You have 15 minutes to complete this skill sheet.
Okay,
Do you have any questions?
I do not.
Okay, you're dispatched for an 18-year-old female, unresponsive at the gym.
Okay. B-side, am I seem safe?
Yeah.
My NOI right now is I have an unresponsive patient. Is this my only patient as well?
Yes.
Okay. I'm gonna call additional resources if I need them. Might as well have them coming en route. And then I'm also always gonna take into consideration ceasefire precautions.
Okay, you arrive on scene. You arrive through the door of the gym. Her friend meets you at the door. Says that they were working out and they're working out pretty hard.
Okay.
And her friend felt lightheaded and dizzy after running on the treadmill, so that she had to lay down and then went unresponsive.
Okay. Did my patient hit their head?
No, she laid herself down.
Okay. Perfect. Well, my general impression of my patients can be poor right now, just because they're unresponsive and passed out. Do I have any life-threatening injuries
No.
to my patient? Okay. And then my chief complaint of my patient right now is unresponsive at the gym, passed out. What's my responsive level when I check level of consciousness?
She's responsive to pain.
To pain. Okay. I'm going to also go ahead and assess my airway. Is my airway patent?
Yep, she's able to maintain her airway.
Okay. Breathing, what's my rate, rhythm, quality?
She is breathing 18 times a minute, regular, moving good air.
Okay. I'm going to consider oxygen therapy too if I need it. What about my pulse? What's my rate, rhythm, quality for that?
Pulse is rapid and regular.
Okay. Circulation for like perfusion, skin signs?
She's pale, cool, clammy.
Okay.
When you're doing that, you notice that she has a medical alert bracelet on that says that she's a diabetic.
Okay. I'm also going to have my partners just start a quick set of vitals as well, including a blood sugar on my patient too. My transport decision, just because she is unresponsive, is I'm going to just start getting her headed towards the ambulance just in case.
Okay. So your EMT partner comes back and says that the monitor is reading low.
Just reading low? Okay. While I'm going to go into my history taking, I'm going to have my partners also start an IV and just get other things set up for me in the ambulance. Since her friend is there, I'm going to just start asking some history, some OPQRST questions. When did this start?
She has been complaining of being dizzy all day. They started working out pretty hard. She's a runner.
Okay.
And they were on the treadmill. She felt lightheaded and dizzy, said that she needed to go sit down, and then ended up laying down.
Okay.
And it looked like she just fell asleep. She doesn't know what's going on.
Okay, so she's not able to really answer any of the other OPQRST questions at this time. My signs and symptoms are dizzy, unresponsive, past history of diabetes, any allergies that we know of?
No.
Any medications for the diabetes?
Yeah, her friend says she doesn't know what they're called. She didn't know that she was diabetic, but she sees her shoot up her Atlantis once in a while.
Okay. Did she see her do that today?
Yes.
Okay. Any last oral intake?
No, they haven't really been eating. They've been on a pretty strict diet.
Okay. Any other special events leading up to this?
No.
Okay. Well, I'm going to also ask any other clarifying questions that I might need for this patient as well. Also taking into consideration other body systems as well, doing a more detailed assessment if needed for like cardiovascular, pulmonary, GI, GU, abdominal, neurological, any of that kind of stuff. Is there anything significant I find with those?
No, her blood sugar still reads low.
Still reads low? Okay. I'm also going to have another set of vital signs going. I'm going to go ahead and push D50. I'm going to do 25 grams and 50 milliliters. I'm going to start with half, recheck my blood sugar, and then if I need to, push the other half.
Okay. You want your vitals?
Yeah.
What vitals do you want?
I want my blood pressure, pulse, respirations, SpO2. I'll get a temperature as well, and then another BGL.
Okay. Pulse is 100 regular.
Okay.
You said you did a cardiovascular one? So you're
Yeah,
gonna do a
just
4
4 lead is fine.
So it's
yeah.
sinus tach.
Okay.
Blood pressure is 120 over 80. Respiratory rate is 18 in regular.
Okay.
Quality is good. And then your blood glucose now reads 60. She's starting to wake up.
Okay. Is there any nausea or vomiting when she wakes up?
No.
Okay. All right. And was that after a full 25 grams of D50?
That's at your 12 and a half.
12 and a half. Okay. Well, I'm going to keep on pushing the remainder of my D50, the other 12 and a half grams.
Okay.
Then I'm going to just reassess my patient, reassess my interventions every 5 minutes. My field impression for this patient is they had a diabetic emergency. They were hypoglycemic. My transport decision is I'm going to just go ahead, load and go, get headed to the nearest hospital, and just make sure that I'm reassessing my patient.
Anything else you'd like to add?
Not at this time, no.
Cool.